Ambassador of Hive Medical Academy in the Central Asian region. Thank you all for joining us today for this exciting webinar. We are here to empower you all with the knowledge and strategies needed to excel in your upcoming exam. But before we dive in, I would like to remind you all of our special offer. You all who are joined in this webinar can get free access to 5,000 latest PLAB MCQs in just 3 simple ways. All you need to do is go to the website of hivemedicalacademy.com and register with your name, email address, and contact number. Second, subscribe to our YouTube channel and share this screenshot via WhatsApp on the following given number in the chat box below. And once we receive that, our administration team will send you the login credentials for free access to those MCQs. So it's a great opportunity to those who are trying to clear their PLAB examination. You all can get 5,000 MCQs access. Now let's get started. I'm thrilled to introduce you all to Dr. Umar. Dr. Umar was a general practitioner in NHS for 10 years. He also held various lecturing, examining, and clinical educational supervision roles for medical students, foundation year 2 doctors, and general practitioner trainees for several years. Today, Dr. Umar will be sharing his insights and expertise with us. But before we begin, I just want to give you a reminder that all of you who are joined with us today can jot down their questions, because at the end we will have question answer session in which Dr. Umar insights on UKMLA will be there and he will answer all your questions. So Dr. Umar, firstly, thank you so much for taking the time out and for being here with us. And without delaying any further, I would like to hand over to you. The floor is all yours, and let's begin.
Thank you, Kidat. It's an absolute pleasure. Thank you, everyone, for attending. It's always fantastic to get up and teach people who are interested in furthering their career, furthering their knowledge. So the pleasure is all mine. Thank you, Kidat. Thank you to all the Hive team, and thank you to everyone who's attended today. Okay, so let's hope we don't have any technical issues. I'm going to share my screen. Hopefully I can do it correctly. Just give me 1 second. Okay. Okay. Hopefully I can do that now. Nope. That's the wrong one, my mistake. All right. Here we go. Okay, can you just confirm that you can see the slide and you can see myself?
Yes, everything is
Okay.
on right. Like it's good.
Okay, brilliant, brilliant. Thank you. Right. So, okay. So, welcome everyone. Our PLAB1 Masterclass. So, thanks for joining. I don't know how many of you have attended any of our things before. Hopefully, you'll find it useful. So, I'll very quickly just go through the aims of today. And a few other things about the session, and then we'll get cracking. So the aims of today are twofold. Number one is we're going to discuss and we're going to share some PLAB1 preparation tips. So that's preparation about studies, how to prepare for the exam. Some tips on MCQs. We're going to go through quite a lot of MCQs. We're going to discuss what kind of exam strategies are useful, how you should approach the questions, whether you're practicing, whether you're actually sitting the exam. And so hopefully you'll get a few really, really useful tips from us around how to approach your preparation as well as the exams. So it's a quite a straightforward session today. There's going to be nothing complicated about it. I'm going to deliver the teaching, and then we will have a question and answer session at the end for anything you want to ask live, or feel free to type your questions in the chat box. The team will keep an eye on them, and then we'll try to address them at the end. In general, otherwise, just please keep your microphones muted so that you don't disturb the session. But if I need some interaction from people, then I will ask you to unmute and join in. But generally, we'll be doing it through the chat box. And don't forget, guys, we've already told you about free access to 5,000 MCQs. just stick around. We'll put some more details about that into the chat box, and then hopefully you will take up that offer and you will get a huge benefit from using some of our best resources. Okay, so just before we get started, let me just see. I just wanted to sort out my screen orientation. Just trying to get the chat box somewhere. Right, okay, that's fine. All right, guys. So whoever's on today, please just drop your location into the chat box. Let us know where you have come from, where you're attending from. It will be a good idea for us to just get an idea of where people are joining from. Drop your city or your country into the chat box. Welcome to you all. It's just a good way of breaking the ice and getting to know who's there. Thank you, Saji from India. You're very welcome. Anyone else, please just drop in your location there. Let us know where you're attending from. Okay, no worries. We seem to have great, fantastic. So we've got someone from London, Anmol. Thank you. Welcome. Northeast Lincolnshire. Fantastic. Lincolnshire's beautiful county. Thank you. London, one of the best cities in the world. I love London. Thank you, guys. Really, really welcome. Great to have you here. Okay, fantastic. So let's get started. Okay, so let me just get my slides ready. Whoops. Okay, so we'll start first of all just with some study tips and some tips in general about how to prepare for the PLAB1 exams. Okay, so as you guys all know, hopefully you know a bit about the PLAB1 exams already. If not, don't worry, you'll get lots of information on it today. Any questions you have, just drop them in the chat box or contact us afterwards. We'll go through things. If you want to book a consultation, that's fine as well. So it's a big syllabus. It's a level of FY2, the beginning of FY2, which is a level of the first year senior house officers. So there's lots and lots of conditions, management, and knowledge, and things that you need to be aware of, things that you need to know how to perform and practice, etc. So there's lots of stuff to cover. So obviously, whenever there is something big that you need to attack, you need to plan it first. So planning is absolutely essential. If you have help with that, that will be better for you. If you're trying to tackle it yourself, you need to be extremely good at knowing what you need to cover, when you need to cover it. Second thing is, obviously, you're going to have to study, you are going to have to work, you are going to have to learn things. You know lots of things already. That's fantastic. But what PLAB is all about is getting you safe for UK practice and getting you approved for UK practice. So it might be that you'll have to modify some of your knowledge, you'll have to improve it, you'll have to get in there the relevant things for the UK guidelines, etc. So there is going to be quite a lot of work that you're going to have to do. Obviously, you'll need to practice. It's a MCQ-based exam, so the more practice you can do, the better. But practice for the sake of practice on its own is not always the best thing for you to do. What you need to do is you need to have focused practice with up-to-date questions, and then as things become clear, you need to change or alter your study plan to focus on your weak areas. So you need to plan what you're going to do. You need to start studying, then you need to practice, and then after your practice has commenced and you start seeing how you are doing, you need to then focus on the weak areas, go back to the planning, change the plan a bit, and then continue with your studying again. And that obviously is the bit that is done. That is obviously the analysis, and it's like a cycle. Imagine it like a cycle. You start from the plan, study, practice, analyze how you're doing, and then go back to the planning and studying and carry on. So that's a basic, very basic kind of outline of how to approach your study. There's a few other things that I would like to mention. just before we get into having a look at some MCQs and chatting about some MCQs. Learning style, I think this is really, really important, and it's something that tends to get ignored, unfortunately, in lots of approaches to things. You need to be aware of what your best learning style is. You know, are you a visual learner? Are you a rote learner? Are you somebody who likes to just practice? Are you somebody who likes to study, make notes, and then, you know, it depends on, there's lots of different styles, visual, etc. So you need to have some self-awareness of what your learning style is. And, you know, we can help you with that as well. So if you need some help deciding what that is, we're happy to do that with you. Learning style is really important. Make sure you're aware of it, because that will maximize the benefit you can get out of your study. The second thing I want to speak about is the knowledge. So we've already touched on this already. There's lots of things to cover. The key part is it needs to be useful, relevant, up-to-date knowledge for UK practice. So there's no use learning lots and lots of things that aren't going to help you in the exam. It needs to be focused, it needs to be UK orientated, and it needs to be up to date. The third thing I want to mention, the final thing on this, is about exam technique. Now, obviously, imagine someone who's really, you know, they're full of knowledge, they're fantastic, they've got lots of, you know, they've spent lots and lots of effort, lots of study, etc., but they don't know how to actually approach the exam, or they don't know how to tackle the exam itself. Exam technique is as crucial as any of the other parts. You need to know how to read, approach, think about, you know, and rationalize the answers, and how to choose the best answer. All of these things are extremely important. Obviously, today our focus is going to be on doing some practice and using that to bring out examples of these things that we've spoken about. And then obviously you have the opportunity to join us and do all of these kind of things in much more detail. Okay, so just before we move on to the actual MCQs themselves and start having a look at some, let's have just a few minutes on MCQs and how to approach the MCQs. So there are three key points that I think are really important for anybody who wants to sit their PLAB exam or any other MCQ-based exam, whichever that might be. First thing is what is being asked. Second thing is don't get distracted by irrelevant information. And the third thing is time management. All these three things are really, really important. So when we say what is being asked, what we mean by that is, obviously, we know there's a time pressure. We know that you have 180 questions to answer, but do spend time reading the question properly. Make sure you understand the question. Make sure you understand what is being asked before actually moving on to considering the answers. What you don't want to do is you don't want to get in a position where you skim read it or think you've read it, and what your brain actually does is suggests to you what the question is asking. You don't want to do that. You want to read it properly. You want to get a proper idea of what exactly is being asked before moving on to consider the options. The second thing, not getting distracted by irrelevant information. So there will be scenarios, and we'll see some of them in the example questions we do today, where there are things that aren't relevant to the actual scenario. By not being relevant, what I mean is they are not going to help you decide on one answer over another. Obviously, they are relevant to the scenario. That's why they're in there. Sometimes they can be very distracting. What you need to get used to is highlighting the key points in the actual question scenario itself. Now, you might have to do that mentally, but you need to focus on those points that are relevant for what is being asked. So obviously you need to understand what is being asked first. Then you need to decide what are the key points to help you choose the answer and not get distracted by irrelevant information. The final point on MCQs is time management. So 180 questions, 180 minutes. That is time pressured, but you have 1 minute per question. You need to try to stick to that. Obviously, if a question is taking much longer, you're not able to decide, it's better to flag it, to do your best answer at that point, flag it, and then come back to it if you have time at the end. Don't leave anything unanswered, but don't also spend so much time on it that you're affecting subsequent questions, which might be straightforward for you. Okay, so right. Okay, so hopefully them things are clear. If there's any any points you want to raise, any questions about them couple of slides, drop them in the chat box. Otherwise, we'll get started with having a look at the actual questions themselves. Okay, so let's try to I'll read out the question. We'll start off with what I think is an easy one. Easy being, it's quite straightforward. The scenario is straightforward, and the question is asking something pretty straightforward as well. We don't want to scare you guys off at the very beginning. I'll read out the question, read out the options. I'll give you a minute or best part of a minute to see what you think, and then we'll drop your answers in the chat box, and then we can have a look at what everyone thinks and we can discuss things together. So first question is, a 32-year-old miner was rescued after being trapped under a fallen rock for 4 hours. After applying a bladder catheter, 15 to 20 mils of reddish brown urine was obtained. He has a systolic blood pressure of 100 millimeters of mercury and a pulse rate of 130 beats per minute. What is the single most appropriate next management? So the options are dopamine intravenously, B, intravenous fluids, C, furosemide intravenously, D, 20% mannitol intravenously, or E, intravenous antibiotics. So if you need a bit more time, that's fine. Otherwise, drop your answers into the chat box, and let's see what everybody thinks. Thank you, Saji. You've gone for D. Okay. What about anyone else? Come on, guys. Don't be shy. Just drop it in there. Don't worry. It's a safe space. We're here to learn. We're here to share learning with each other. So don't be shy. Just drop your answer in there and we'll have a chat about it. Fantastic. There's an answer for B from Dr. Cherry. Thank you. Thank you for participating. Anyone else? Give you another few seconds to have a go. Okay, last call for question 1. Any guesses? Okay. No worries. So I think everyone's probably had a minute or just longer than that. Okay, so there were 2 answers there. There's one for D and then one for B. So let's have a look at what the correct answer is. Okay, so the correct answer is B, intravenous fluids. So well done, Dr. Cherry. Fantastic. That's the correct answer. If you want to, if you want to say anything about why you think it was the correct answer, or if you want to share your thoughts in there, that's fantastic. Otherwise, no worries, we'll break it down. Dr. Saji, don't worry, that's okay. We'll break through, we'll break down what's actually happened here. So let's just have a look at the scenario itself, and then we'll break down the actual rationalization of it. So this is somebody who's collapsed, they've fallen, they've been trapped under a rock for 4 hours. What is the main concern that we have when this happens? It, of course, is rhabdomyolysis. That is why there is some reddish brown urine. Now, obviously, there are some other key points to note. And remember what we said about reading the question properly, highlighting the key points. The key points is someone who's fallen, they're trapped, they had a catheter put in and there's reddish brown urine. Do note as well, it's only 15 to 20 mils. That's not very much. Obviously, that's a concern as well. Other key things are systolic blood pressure is 100 millimeters of mercury, just slightly on the lower side, and the pulse is 130 beats per minute. So what does this scenario tell us? It tells us that this person might be might be fluid depleted. That's the first thing. Also tells us that the process of rhabdomyolysis might have started. So obviously we have to recognize that, there's signs of hemodynamic instability there, the pulse rate's high. That could be because of pain as well, or it could be because of adrenaline, etc. But we have to bear in mind that this could be fluid depletion as well. So we have to recognize rhabdomyolysis, we have to recognize some of the signs, and then we have to think about what do we have to do next. So it says, what's the single most appropriate next management? Now, of course, we, the first thing that we should do, someone with rhabdomyolysis, is intravenous fluids, or anybody with any signs of hemodynamic instability, possibly dehydration, or they've had some fluid depletion, intravenous fluids. Now, what I just want to highlight here is the fact that our friend who suggested the other option is actually not entirely incorrect. So that would be correct later on. But the question is asking about what is the single most appropriate next piece of management now. So what's the first thing we have to do? So furosemide might be used at some point. Mannitol might be used at some point. Dopamine isn't really appropriate here. Intravenous fluids has to be the correct answer. Intravenous antibiotics is totally not relevant whatsoever. Okay, so well done. Let's move on and have a look at the next one. Okay, so we'll get things warming up now. This is a bit more challenging, a bit more typical of a kind of scenario you're likely to be faced with. So an 89-year-old woman with a history of end-stage heart failure resides in a nursing home. She continues to exhibit shortness of breath. Her oxygen saturations remain at 90% on room air. She takes regular beta blockers, ACE inhibitors, furosemide. She's bedbound and fully aware of her prognosis. She understands the terminal phase of her illness. Which of the following is the most appropriate next step in managing this? So options are A, increase the dose of furosemide. B, add digoxin to her current medication regime. C, refer to the palliative care team. D, initiate sacubitril or valsartan in place of the ACE inhibitor. Or E, increase supplemental oxygen to maintain saturation above 90%. So once again, guys, please pop your answers into the chat. Let's see what you think. Don't be shy. It's all about learning and sharing our learning with each other. And this is how we are going to progress, and this is how we're going to get better with things. Come on, guys, drop your answers in there. Let's see, what do you think? I'll give you a minute. Okay, so Dr. Sedji says Increase supplemental oxygen to maintain saturation above 90%. Okay, excellent. Thank you. Anyone else? Anyone else care to have a go? Okay, no worries. Thank you, Dr. Saji, for having a crack at that. Let's have a look at what the correct answer is. Okay, so correct answer is C, refer to the palliative care team. Okay, now let's just go back to the question. Let's try to do what we should be doing, which is highlighting the key points of the question and see why and how that should bring us to the correct answer. So the key words and phrases to note here are that this is someone with end-stage heart failure. So that's mentioned right at the beginning. It's an 89-year-old woman, so it's an elderly woman, end-stage heart failure. And there's also this phrase here, I've lost it now, where it says that she's a terminal phase of her illness. She understands that this is a terminal phase of her illness. So what this scenario is suggesting to you, that this is an elderly person, the end-stage heart failure, that means, and they are in the terminal phase of illness, and the patient understands this. We can also see from the scenario that she's saturating at 90% on room air. Okay, this might seem a little low initially, but we'll discuss that in a second. She's on beta blockers, she's on ACE inhibitors, she's on furosemide, she's on quite a few medications. She's bedbound as well. And so again, same kind of scenario, the question is asking, what is the most appropriate next step in managing this? Now, one key thing I want to highlight here, guys, is that there is no mention, despite it saying that she's end stage and that she is, that she's in the terminal phase of her illness, there's no mention of palliative care team. So we have to assume that this is not already done because the scenario doesn't say palliative care is involved, or so if it's not mentioned, we have to assume it's not done. So that's the first kind of thing we should notice after seeing that these other phrases are mentioned. So that actually changes the scenario for us. So we'll go through the other options. So the medical options, increasing the dose of furosemide. Okay, yes, maybe that might maybe that could potentially improve her symptoms. But remember, in a palliative care scenario, when someone's in the terminal phase of illness, we're focused on improving comfort and relieving the overall symptoms of the patient. So doing things like increasing dose of furosemide or changing her medication to valsartan instead of the ACE inhibitor is not really appropriate, because when we say we're in the end stage and we're in terminal phase, we're kind of, our active treatment of the condition to actually improve survival is no longer the main consideration. Main consideration is to actually keep the patient comfortable and relieve their symptoms. So adding digoxin, again, another kind of medical intervention that's not going to achieve our main thing for us. The only one I want to highlight here, which is the one that was answered by Dr. Suji, and I'm glad that somebody chose this one, is that this doesn't seem like an unreasonable thing to suggest, to say increase supplemental oxygen to maintain saturation above 95%. Sensible answer. She's only saturating at 90%. She's only saturating at 90%. And so that seems low. However, for somebody who's palliative care, is on air, that's not necessarily horrendous. We don't want to intervene with anything else. And I think the key thing that really swings it for me in the wording is increase supplemental oxygen. It doesn't say to improve her shortness of breath. it says to maintain saturation above 95%. So that gives you a clue that actually, if you think about it, I'm not aware of any guidelines about keeping people's saturations above 95% in end-stage heart failure. So this actually should tell you that this this answer is not correct as well. So going through all of them things, that draws us to referring to the palliative care team. As I said, the big clue was that it's not mentioned in the scenario already, but other clues are mentioned about palliative care. And so this one is the one that makes most sense. I hope that is clear, and I hope the explanation of that is clear. If not, no worries, drop a message and we can discuss it further. So thanks for participating in that. Let's move on to the next one. Okay, so we're going to have a look now at this scenario. So 52-year-old man presents with a sudden complete loss of vision from the right eye. He's also been complaining of right-sided headaches, which would come up, which would start or be more prominent on chewing. On fundoscopy, the retina was pale and a cherry red spot could be seen in the macular region. What is the single most likely cause of visual loss? Options are open angle glaucoma, branch retinal vein occlusion, branch retinal artery occlusion, branch retinal vein occlusion, or central retinal artery occlusion. So once again, guys, have a go, have a read yourself, take a little bit of time, see what you think is the correct answer, drop it in the chat box, and then we will work through it. I'll give you a minute.
Sir, we can't hear you. Sir.
Sorry, guys. Yeah, I was on mute. I was just saying, thank you, Dr. Seji. Thank you, Dr. Cherry. These guys are the stars of the webinar, dropping their answers in there. Thanks to both of you. Okay, so unless anyone else has any suggestions, we'll move to discussing the correct answers. So we had suggestions for C, which is branch retinal artery occlusion, and we also had a suggestion for A, which is open angle glaucoma. Okay, now the correct answer is E. Correct answer is E, which is central retinal artery occlusion. Now, don't worry, guys. This, I think, is quite a difficult question. We'll break it down. We'll have a look at what I think has possibly happened, and then we can work through why E is actually the correct answer, and hopefully you guys will understand that a bit better. So the first one I want to go to is the suggestion for open angle glaucoma. Now, okay, I might be assuming here, if I'm incorrect, please do let me know. But I think someone might have read the scenario and thought this is a man presenting with sudden visual loss and is associated with headaches. And so we've thought glaucoma straight away. However, do take note of the other pieces of information in the scenario. So it's complete visual loss, yes. He's could be complaining of right-sided headaches, which are worse on chewing. Okay, so this is a very key part of this scenario. What kind of headaches are worse on chewing? Kind of headaches associated with temporal arthritis or giant cell arthritis. Okay, so that's a big clue for us. Then, of course, we've got to go to what are the features that we can see on examination. On fundoscopy, there was a pale retina and a cherry red spot could be seen in the macular region. So there's a couple of things we can discuss here. The first is you either need to know what the retinal features of central retinal artery occlusion are, or you need to know that central retinal artery occlusion can be a consequence of giant cell arthritis. And so, whichever way you get to the answer, it doesn't really matter. You either need to know the features of central retinal artery occlusion, or you need to know that it can be a consequence of giant cell arthritis. So this is what we're saying about knowledge. So your knowledge needs to be combined and applied together with exam technique to help you arrive at the right answer. So they are the key bits of information here. And as we said, so it's about 10% of patients who have temporal arthritis or giant cell arthritis, they can get ocular involvement. And the most common kind of complication, 10% of those with ocular involvement will get central retinal artery occlusion. And these are the features of central retinal artery occlusion. So pale retina, cherry red spot seen in the macular area. So difficult knowledge-based question, which actually needs you to combine, a couple of parts of knowledge together, or just recognize it from one of the features there. So don't worry, that's what we're here for. We're here to have a go at these questions. We're here to learn about them. We're here to try to improve our exam technique and get us closer to being successful in the PLAB1 exam. Okay, so let's move on to the next question. All right. Yes, this is the next question. So do participate, guys. It's for your own benefit. So a 45-year-old man presents to the infectious disease clinic. Right. This is an ethics-based question. I absolutely love ethics-based questions. Not sure about you guys. So 45-year-old man presents to the infectious disease clinic with the new diagnosis of hepatitis B. He expresses concern about informing his wife about the diagnosis. What is the most appropriate course of action? The options are A, encourage him to tell his wife, B, inform the wife because of the immediate risk, C, respect the patient's wishes and maintain confidentiality, D, refer to a sexual health clinic, or E, advise the patient to temporarily separate from his wife to prevent transmission. So take a minute, guys, if you need, have a read of the question, drop your suggested answer in the chat box, and then we'll have a chat about it. Fantastic. We're getting some answers here. Suggestions for E. Okay, we've got some consensus in the audience. That's good. That's really good. Thank you guys for dropping your answers in there. Dr. Cherry says A, encourage him to tell his wife. The other guys are saying advise the patient to temporarily separate from his wife to prevent transmission. Okay. Anyone else? Last call for answers for this question before we have a chat about it. Please drop it in there. Otherwise, thank you for participating. Okay, right. Let's have a look at the correct answer. The correct answer is A, encourage him to tell his wife. Well done, Dr. Cherry. Fantastic. Everyone else, don't worry. Let's work through the scenario and see what we should be focusing on and see what we should be trying to do to bring ourselves to the right answer. So the key thing I want to highlight here, first of all, is that this is a new diagnosis. Okay, so new diagnosis. What that means is, perhaps is speaking to an expert about it for the first time. Perhaps he's speaking to a doctor about it for the first time. Okay, so it's early on in things. There's no mention in the scenario about him being asked to inform his wife before, or anything about him refusing to do so. These two bits of information are absolutely key. So the first thing is, just after noticing that, what is this about? This scenario is about confidentiality, and it's about confidentiality specifically in serious infectious disease. So, okay. So what else can we notice from the information that's given to us? He expresses concern about informing his wife about the diagnosis. So that's very carefully worded. What that says is he's a bit worried about it. He's not sure about it. He's not sure whether he wants to do it. Perhaps he's not sure how to do it. Perhaps he doesn't know how to actually go about it. It doesn't say that he doesn't want to tell his wife, or he wants to hide it from his wife, or or anything else. So let's have a look at the options. Okay, so let's look at the incorrect options first, and let's see what's problematic with them. Okay, so B, informing the wife because of the immediate risk. Okay, in this scenario, this is inappropriate. In a slightly different scenario, it might be appropriate. For example, if the scenario said that you've spoken to him, or somebody else has spoken to him, and he's refusing to share this information with his wife, then this could be the correct answer. But here, currently, is first time you're probably speaking to him. All he said is a bit worried about it. And so just informing the wife straight away because of the immediate risk is not the appropriate answer here. C is also incorrect because, to maintain confidentiality. Just want to highlight here that the GMC is very, very clear. In serious infectious diseases, we need to inform people at risk of infection. The ideal scenario is the patient does it themselves. Obviously, it'll be better coming from themselves. However, if they are refusing and you've tried, then we can break confidentiality. So we can't maintain confidentiality in this scenario. So that's why C is incorrect. Referral to a sexual health clinic, I mean, it's an appropriate thing to do for the scenario in general. Someone's just got a new diagnosis, could be sexually transmitted, refer to the sexual health clinic. However, it's actually an irrelevant answer. It's not what the question is asking you. Question is asking you what's the most important thing and appropriate thing for you to do now. By referring him to the sexual health clinic, you're just passing the buck for someone else to deal with the problem. So that's incorrect. E, advising the patient to temporarily separate from his wife to prevent transmission. So quite a few people said that. I can understand why, but there are a few questions that would come to my mind about that. Number one, should we be informing patients or advising patients about things to do in their relationship that are, asking them to separate, for example? Does that sound appropriate? I would say, even if you, your first gut instinct should be that doesn't sound appropriate. The second thing is, if you do that, you separate temporarily, and then, what happens later on, so it just doesn't quite fit. It doesn't make sense. It's not the correct thing to do because it's not going to actually address the key point of the scenario, which is he's a little bit worried about telling his wife. You need to have a conversation with him. You need to encourage him, tell him it's the right thing to do. And because obviously she's exposed to risk, and you can go through the kind of things that are important to consider there. So hopefully, guys, that was helpful. There's an ethical one. These can be quite difficult. I really like these kind of questions because it gets you thinking. It gets you to think that actually, do I know about my confidentiality guiding principles? Have I looked at the GMC guidance? Am I aware of them? So that's a really, really useful one. And I hope you guys found that useful. Don't worry, don't worry about getting the wrong answer. Obviously, we want you to get the wrong answers here. We want to get you the wrong answers in practice, learn about it, and then get the correct ones in the final exam. All right, so let's have a look at, we've still got quite a few more questions. I'm just conscious of time. I don't want to go over too much on people's time. So let me just pick one more. I'll pick another one, which I think will be, this one's also a good one. It's a pretty kind of bread and butter type PLAB1 question. Probably not much scope for discussion on this one. So I will pick, let's have a look at, here's another one. So we'll keep with the ethics kind of theme because these can be quite difficult. This one, again, I think you find this really useful. The good thing about these are they are real life scenarios. This is what you're going to be faced with while working in the UK. And these kind of things happen all the time. So PLAB1 is really helpful for that. Okay, so you're working in A&E. You see a male patient with melena with a possible upper GI bleed. He refuses to wait for the urgent endoscopy that is arranged, and he wants to leave hospital because the wait is too long. You can't understand this yourself. You can't understand this decision, but you've already tried to explain the risks of self-discharge. What is the next most appropriate action? So again, I would say this is not a very easy one, guys. So let's see how you get on. A, suggest he goes to see his GP in 2 weeks if he feels no better. B, ask your registrar to speak to him to force him to stay. C, arrange a psychiatric review as his decision is unreasonable. D, call the patient's wife to persuade him to stay. Or E, offer to arrange an urgent outpatient endoscopy later in the week and advise for him to return to A&E if he is unwell or has further symptoms. So I'll give you a minute, guys, to have a read of that yourself. Maybe it's a bit awkward listening to me reading it out. So have a read, have a go, drop your answers in the chat box. We'll have a chat about that. And then we can hopefully see what we've learned from today, and we can wrap things up there. Okay. Okay, guys, have a go. Drop your answers in there. Don't be shy. It's good. It's good that we see how your thinking works, and then we can learn from it. Everyone can learn from it, and you can learn from it as well. So please do drop your suggested answer in there. Thank you. Okay, thanks, guys. So we've had two suggestions for E. No other suggestions so far. So again, we've got some consensus in the group. Let's have a look at what the correct answer is, and then we can break things down. Okay, so the correct answer is E, offered to arrange an urgent outpatient endoscopy later in the week and advised to return to A&E if the patient is unwell or has further symptoms. So fantastic. Well done, guys. Brilliant. Let's just have a look at the key parts of the scenario. What were the things that we were looking at? So the crux of this question is capacity. This is a capacity ethical scenario, and the most important thing to note here, again, by its omission, is the fact that the scenario doesn't say that the patient doesn't have capacity. So we have to assume that the patient has capacity because we have no information to suggest otherwise. And, we might not agree with the patient's decision. It might seem unreasonable to us. We've tried to explain things, but the patient just doesn't want to wait. So that means, what is the next best thing we can do? So if a patient seems to be making an unreasonable decision, but they have capacity, what we have to do as the medic is we have to offer them the next best option. So let's look at the options very quickly, go through why they are, why the other options aren't the next best thing. So suggesting he goes to see his GP in 2 weeks, okay, he gets to have some follow-up, but it's 2 weeks later. Endoscopies are not done in primary care, so that's actually going to delay things. Asking your registrar to speak to him, to force him to stay, that's the key bit of that answer there. Asking your registrar to speak to him by itself is not an unreasonable suggestion, but to speak to him to force him to stay is because, remember, we're assuming because of the information in the scenario, he has capacity. We can't force him to change his decision, so B is incorrect. C, arranging a psychiatric review as his decision is unreasonable. Number one, we don't need psychiatric reviews or inputs to assess somebody's capacity. Can be done by any appropriately trained professional. We'll cover some of that in a different teaching session. And also it says because his decision is unreasonable, and that's not a reason to get somebody else involved because it's unreasonable. So C is out. D, calling the patient's wife to persuade him to stay. Doesn't say about calling her jointly, which might be an appropriate thing to do because you want to see if, she might be able to convince him. But it just says call the patient's wife to persuade him to stay. That's going to breach his confidentiality. We're not in a breaching confidentiality kind of scenario, so that's inappropriate. Therefore, the best option is offer an outpatient endoscopy, which is urgent, later in the week, and safety net him by asking him to return to A&E if he's unwell or he has any further symptoms. So I hope that's clear. There's some good answers there, some ones that we were able to learn from. Hope you found them MCQs useful. I'll just quickly summarize now what we covered today. I'm conscious that obviously we said it's an hour, so we'll try and stick to that. So PLAB1 success requires what? It requires relevant, up-to-date knowledge. It requires practice, but practice that is focused and it's beneficial. So it needs to be with the right resources and it needs to work together with the up-to-date knowledge in tandem to make sure your practice is identifying areas that you're strong at and you're weak at, and then you're filling those areas, filling those gaps with your study as well. And the final thing which we've spoken about is good exam technique. Remember them things, reading the question properly, not trying to understand what is it exactly asking you, ignoring irrelevant information, and time management. The final thing I'm going to say is obviously we're here to help with that. That's what we do. We love helping people prepare for PLAB1. Do take advantage of the free access to 5,000 MCQs. That is a fantastic offer for you guys. So do follow the instructions. We'll drop them again in the chat box. But also just wanted to note that, as we've said, 5,000 MCQs on their own, practice without the correct knowledge is not really the right thing to do. So our most comprehensive way of helping is our PLAB1 premium package. Just very quickly, what do we have in there? We have 3 live sessions, 24-hour access to our course tutors, video course, audio course, 10 PLAB mocks full of questions, just like the one we've done. That's 180 questions in each mock. 10 of them is timed, and access to 5,000 of the MCQs. And we have 250 digital flashcards. So if your learning style is a bit different, you like to do revision with revision cards, that's all you need. This package is all you need to clear PLAB1. Access is for 12 months. And that's all I'm going to say on that. So thank you very, very much for attending, guys. If you have any questions, or if there have been any questions that are, perhaps to do with anything else relevant to PLAB, obviously, and UKMLA, please do ask them. There's not too many, we're okay to go on unmute and ask something if you want to. That's perfectly fine, or drop it in the chat box. We'll give you a few minutes to do that. We'll see if there's any questions. We're happy to take questions and answer them. Akidat, I'll hand over to you to just kind of manage the questions part if there are any questions before we wrap up. Thank you.
Thank you so much, Dr. Umar. I think the webinar was quite beneficial for all the students because I feel like you have given a great insight on UKMLA. Now, I would like to ask every one of you if you guys have got any questions regarding anything on the path of UKMLA, how to clear UKMLA, or how to reach there, like any questions regarding anything. You guys are feel free to ask any question. You can also ask in your native language. Like if there is any language gap you feel, you can also ask in your native language and you can write it down. Otherwise, we can also unmute you.
Yeah, so we can speak Urdu, Punjabi, Hindi, and English. I don't think there's any other languages in our team, but that should cover everything. And just to clarify as well, UKMLA and PLAB tends to get used interchangeably. UKMLA, obviously, for UK based students, PLAB for international medical graduates. Essentially, it's the same exam with a different name, but there's one SAT for the IMGs, international medical graduates. That's the PLAB. It's called PLAB1, PLAB2. And then UKMLA is for UK graduates at UK medical schools. But essentially, they are the same thing. So our syllabus covers both. But yeah, any questions, please unmute yourself, put your hand up, talk, drop it in the chat box. We'll give you a few minutes to do that. Thank you.
Just think deep if you guys like have any question, because like for students, I think you guys sometimes feel shy in asking questions, but questions are the things that will lead you towards your success. So you guys can